If you've been diagnosed with a partial rotator cuff tear, you may have been told, try physical therapy, take some anti-inflammatories, maybe get a steroid injection, and if it gets bad enough, we'll talk about surgery. But there's an important problem with that approach. What happens to the tear while you're waiting? A partial rotator cuff tear isn't simply a painful shoulder. Over time, a large proportion of these tears get larger, and eventually they can become full thickness tears that require painful surgery with a long downtime. So the question isn't only, how do we make your shoulder hurt less? The bigger question may be, can we actually help the tendon heal, or at least prevent it from getting worse? And that's where some very interesting research on bone marrow concentrate, or BMAC, comes in. Your rotator cuff is made up of 4 muscles, and they're tendons that help move your arm and stabilize your shoulder. A partial thickness tear means one of those tendons has been damaged, but it hasn't torn completely through. The supraspinatus is the tendon we see most commonly involved on the top of your shoulder. Patients may notice pain reaching overhead, weakness when lifting something, pain with exercise, or difficulty swinging a golf club. And one of the classic complaints I hear is, I couldn't sleep on the shoulder anymore. One of the biggest misconceptions is that if you simply rest long enough, the tendon will heal itself. Unfortunately, rotator cuff tendons have a very poor blood supply, and partial tears don't usually heal on their own. In fact, many, if not most of them, gradually enlarge because of age-related degeneration, mechanical stress, and continued wear. You never quit using your shoulder. And that's important, because once a partial tear progresses to a full thickness tear, the tendon can retract. The muscle can weaken and eventually develop fatty changes. And at that point, repairing the tendon surgically can become much more difficult, and in some cases, it's not even possible. So when I evaluate someone with a partial rotator cuff tear, I'm thinking about 2 things. How do we make you feel better now? But also, how do we preserve this tendon for future? That's where BMAC becomes interesting. BMAC stands for bone marrow concentrate. And we collect a relatively small amount of your own bone marrow, typically from the back of the pelvis. We process it during the same visit. The resulting concentrate contains platelets, growth factors, anti-inflammatory proteins, immune cells involved in healing, and stem cells. So, despite what you may see in advertising, BMAC isn't simply a stem cell injection. It's a very complex biologic treatment. It contains multiple cells and signaling proteins that may help improve the environment around an injured tendon and support healing. So now let's get to the really interesting part of the research. Dr. Don Buford and his colleagues followed patients with partial thickness rotator cuff tears for nearly 8 years after ultrasound-guided BMAC treatment, and the results are really encouraging. Nearly 80% of the patients avoided rotator cuff surgery during follow-up. Patients experienced significant improvements in their pain and their shoulder function. And approximately 1/3 showed imaging evidence of complete tendon healing on follow-up ultrasound. But there's another finding that I think may be even more important. The treated tendons appeared to progress to full thickness tears much less frequently than we might expect based on the natural history reported in previous studies. Think about what that could mean. We may not simply be talking about making a painful shoulder feel better. BMAC may have the potential to change the progression of the disease itself and help appropriately selected patients avoid surgery. Now, I want to be very clear. This was not a randomized controlled trial, so we can't say that BMAC definitively prevents rotator cuff tears from progressing. We need larger, high-quality comparative studies. But nearly 8 years of follow-up combined with imaging makes these findings really encouraging. So, does every partial rotator cuff tear need BMAC? Absolutely not. PRP has good evidence supporting its use for many tendon conditions, including small partial rotator cuff tears. I might consider BMAC when we're dealing with a larger partial tear, more advanced tendon degeneration, poorer tendon quality, persistent symptoms despite conservative treatment, or previous treatments that haven't provided adequate improvement. The goal isn't to give everyone the most expensive or the newest biologic. The goal is to engage in shared decision-making with an informed patient to choose the appropriate treatment for their own unique situation. Okay, so there's another important piece to this. If I'm treating a tear in your supraspinatus tendon, I don't want to simply inject BMAC somewhere into your shoulder. I want the biologic placed precisely in and around the tendon tear that we're trying to treat. That's incredibly important to get the best outcome, and that's why we do these procedures under real-time ultrasound guidance. I can see the tendon, I can see the tear, I see the needle, and I can put the treatment precisely where I want it, because I'm literally watching the BMAC fill up the tear. Because with regenerative medicine, what's in the syringe matters, but where you put it matters just as much. BMAC may be worth considering if you have a symptomatic partial thickness rotator cuff tear, you've continued to have pain despite physical therapy, your shoulder is interfering with your sleep or everyday activities, and you're hoping to avoid surgery if that's medically appropriate. But regenerative medicine isn't a substitute for surgery in every patient. If you have a large, traumatic, full-thickness tear with significant tendon retraction or profound weakness, surgery may still be your best option. That's why everything starts with a precise diagnosis. So if you've been diagnosed with a partial rotator cuff tear, don't think only about how to control the pain you're having today. Ask another question. What's happening to my tendon over time? Because our goal shouldn't simply be to slap a Band-Aid on the problem and help you hurt less. Whenever possible, we want to preserve the structure and function of your shoulder so that you remain active for years to come. At LifeStem, we start with a comprehensive evaluation, review your imaging, assess your overall health and healing potential, and then determine whether PRP, BMAC, surgery, or even another treatment makes the most sense for you. The right patient, the right biologic, the right place at the right time. I'm Dr. Amy Adams with LifeStem Regenerative Medicine. If you have a partial rotator cuff tear and want to know whether regenerative medicine may be an option for you, we'd be happy to evaluate you and help you understand your choices.